Hello everybody. Today I'll be talking about my senior capstone study, which will be on spinal manipulation for low back pain. So some general things about low back pain. It affects both the athletic and non-athletic population as well as all different age ranges. It becomes a chronic condition once it reaches the 3-month mark and anything past that, and that it affects 85% of the adult population. So some things that could cause low back pain can range from anything like a ligament sprain, a muscle strain, any type of disc pathology, arthritis, or spinal irregularities such as scoliosis. So there are a couple different treatment routes that can be done for low back pain. This study will be focused on the conservative side of the treatment. And so this will be pretty much any physician's first option. They will refer the patient to physical therapy where they will then go through a rehabilitation plan and potentially get the use of modalities such as electrical stimulation as seen in the picture. There's also heat packs, ice packs, and traction machines. But the modalities do not solve the underlying problem. It will be more of the rehabilitation side that helps to fix and prevent this problem from going on any further. So like I was talking about for rehabilitation, for low back pain, the core stabilization exercises has been the main focus and have had the best results this far. And the theory behind it is that the core attaches to the spine. And so if we strengthen the core muscles, that it will help support the structure and stability of the spine itself. So getting into the spinal manipulation part, it is performed a lot more than we think. It can help reduce the amount of pain and disability with the chronic low back pain, and it can help increase the range of motion, muscle recruitment, and blood flow, which in theory should help the healing process for this condition. So going on with more spinal manipulation stuff, it can be used to treat degenerative disc disease in people who are older. So this can be performed on young people, old people, middle-aged people. Age doesn't really matter. It's more about the comfort of the caregiver. But there is not like a golden standard for the amount of treatments and the time between treatments. So the person suffering from the chronic low back pain or any type of low back pain can have spinal manipulation performed on them as they need it or as often as they would like. So a condition that spinal manipulation is beneficial for is both acute and chronic low back pain, and it's focusing mainly on decreasing the amount of pain the patient is experiencing, and it will improve joint nutrition through the movement of the synovial fluid, and it will stimulate blood flow to the area of injury. So the kickstart method is the type of spinal manipulation that this study will be using. And so the big picture on how to perform spinal manipulation is that the patient will be laying in a supine position, so on her back with a lateral bend and rotation. and the clinician will provide the high velocity, low amplitude force to the lumbar spine. So now I'm going to kind of break that down into more simple terms in a step-by-step process. So you're going to have your patient lay on their side facing the clinician, and then you are going to pull their bottom arm until their back becomes more parallel with the table. And then with your other hand, you're going to find the space between two of the lumbar vertebrae, and you're going to keep your fingers there. You're going to bring the top leg of the patient into a flexed position at the hip and knee, and feel when those two vertebrae between your fingers start to open up. Once you feel that, then you're going to hook the patient's foot behind their bottom leg, basically to keep it from sliding down or moving at all. And then the clinician will place one hand on the top shoulder, which will be off the table, and then their leg on top of the patient's bent leg, and then their other hand will be placed on the patient's sacrum. And so once you get into this position, the clinician will instruct the patient to take a deep breath in and then slowly let that air out. And then once the patient is about halfway through exhaling, the clinician will provide that high velocity, low amplitude force, and then that will be performed on both sides. So once you do one side, you'll have them flip over and face the other way, still facing you, but have their head go to the other end of the table. So for the methods portion of the study, some researchers have had positive outcomes with spinal manipulation, while others have had no change in their patients. The rehabilitation and surgery have shown to be an effective treatment for low back pain, and spinal manipulation needs to be studied more in order to determine if it is a beneficial treatment for acute and chronic low back pain. So the purpose of this study will be to determine if the spinal manipulation on the lumbar spine is a rational treatment in reducing or eliminating low back pain. So here are my variables. For my independent variable, it will be the spinal manipulation, and then my dependent variables will be my 3 measurement tools. They are the global rating of change, or the GROC, the visual analog scale, or the VAS, and then the ODI. So the reliability and validity of these tests, for the global rating of change, there needs to be a difference of 1.7 points on the 7-point scale in order for it to be considered a clinical difference. For the visual analog scale, it is 1.37. And then for the ODI, it's on a scale of 0 to 100. So the difference is 12.8. So here's an example of a global rating of change. This is a 15-point scale. And so this will be one of the instruments used in my study. mainly for the final measurements, because the baseline, when they first come in, they'll be at a 0 on our scale. And then they'll rate if they got better, if they stayed the same, or got worse. And so that will be that. And then for the visual analog scale, it'll be to track the progression of the participant. And so this will be taken every time the participant comes in. And then the ODI will be the more formal patient-reported outcome or measurement tool. And so basically the ODI is a questionnaire that covers all different aspects of your activities of daily life. And then this will be administered before the first treatment and then after the last treatment, so that we can compare what's gotten better, what's gotten worse, what stayed the same. So for my exclusion criteria, I will not be performing spinal manipulation on anybody with prior back surgeries, if they're age of 50 or over, and any non-collegiate athletes. So for my evaluation protocol, I will take them into the office and run through a history of their pain. And then the clinician will get the measurements using a goniometer for their range of motion, which includes flexion, extension, and then lateral flexion going side to side. And then the clinician will give them the visual analog scale and ask them to rate their level of pain, as well as give them the ODI to fill out. And then the clinician will explain the process of spinal manipulation to make sure the patient is comfortable with this procedure. And then the clinician will administer it and then schedule the participant's next appointment. And the clinician will do this every time until they have completed the study. And the study will be a total of 4 weeks with 2 treatments per week, or a total of 8 treatments. So in conclusion, and some key points for this study is that the Kickstart method will be the technique for spinal manipulation. It will be a 4-week study with 2 treatments per week, and it's looking to see what it does for pain, whether it increases, decreases, or stays the same. And here are my references.